If you're watching this video, the chances are good that you're considering LASIK eye surgery. Perhaps you've made a decision that you'd like to have the freedom that comes from not having to wear eyeglasses or contacts.
Whether you're a mother with small children, a college student with a busy lifestyle, firefighter, or athlete, LASIK could be a natural progression for your career or your hobbies.
Commonwealth Eye Surgery, located in Lexington, Kentucky, is the premier institution among the industry. Co-founder and primary eye surgeon Dr. Lance Ferguson opened under the name Commonwealth Eye Surgery in 1988. Dr. Ferguson and his business partner wanted to own and operate an eye care center that keeps the patient's needs as the central focus. Here's Dr. Lance Ferguson.
We try to improve the quality of life. And although I might be able to make an eye better technically, that refraction may not be best suited to that individual's lifestyle. So a lot of what goes into making someone a good LASIK or refractive surgical candidate is what are their goals, and that takes time, and we need to get to know you to be able to determine that.
So how do you know if you're a candidate for LASIK surgery? Many variables must be considered. Number one, having a normal, healthy eye, and number two, having a stable refraction for 1 to 2 years. The third factor, and one of the most important according to Dr. Ferguson, is doing some initial research before you come to see him.
So now you think you may be a possible candidate, but you're wondering, what exactly is LASIK and what does it do? LASIK is an acronym that stands for Laser Assisted In Situ Keratomylosis. LASIK surgery changes the shape of the cornea, which is the clear outermost portion of the eye.
Any surface, if you bend it differently, it'll change the way the light passes through it. So what LASIK does is allows us to remodel the surface of your cornea so you're less dependent on glasses.
LASIK removes tissue within the cornea to treat low to high levels of nearsightedness, farsightedness, and astigmatism. To begin the procedure, a thin flap is made by cutting through the outer layer of the cornea. Once the flap is complete, it's then folded back, revealing the midsection of the cornea called the stroma. Next, pulses from the computer-controlled laser vaporize a portion of the stroma, changing the shape of the cornea. Once this is complete, the flap is then folded back into place and gently smoothed out into its original position. The properly reshaped cornea can then better focus light into the retina, thus resulting in improved vision.
A very common and valid question many patients ask is, does it hurt?
During the procedure, there's a little bit of pressure, and you can simulate this at home. If you were just simply to close your eyes and push pretty hard with your fingers on your globes, that simulates what you'll feel with LASIK. And that's only during the flap formation. After the flap is made, the laser and manipulation of the tissue is totally painless.
Dr. Ferguson's team will get you ready for surgery.
In most cases, patients are very relaxed but are aware of what is going on throughout the process. LASIK is a fairly quick procedure, and most patients are finished before they know it.
But a typical procedure, the person's in and out of the room in total in 15 minutes, and of that time, probably only a minute or two is actually when the laser is being performed.
The end goal of LASIK surgery is to help patients see without the crutch of eyeglasses or contacts. The wonderful part of LASIK has to be the results.
With LASIK, a lot of times they're seeing a little better as soon as they sit up from the table.
Commonwealth Eye Surgery is made up of a team of doctors who are there to make your surgery day go as smooth as possible. Much care and thoughtful evaluation are taken to ensure that you are qualified and that having refractive surgery would indeed improve your lifestyle, from the hobbies you like to the career you've chosen. Commonwealth Eye Surgery is known for their thorough evaluation process, so expect to spend between 2 to 3 hours during your initial consultation.
You do have options in your choice of eye surgeons. But what is the real difference that sets Commonwealth Eye Surgery apart from the rest? Attention to detail.
The most important variable you should consider is whether your surgeon is a nitpicker. And that sounds kind of silly, but the bottom line is your result is dependent on multiple factors, and those factors have to be extremely precise. Is the surgeon's laser the best available? Does he control the environment in his room so the humidity is just right? It's not too humid, it's not too dry. Do they analyze their data so they can alter their data so an individual who is of your sex, your age, your pupil size, and your corneal thickness, because if they don't do all that, they cannot hone their data down to give you the most precise results. If you don't find that commitment, then you're selling yourself short.
Dr. Ferguson was one of the first doctors in the state of Kentucky to perform a LASIK procedure. Since that time, he has performed over 7,000 LASIK surgeries, and 6,000 of those surgeries have been done with the advent of the modern laser technology.
We can actually use a laser and map all the intricacies of one's visual system that's unique to you, and put that on a disc and teach our computer to make the pattern of correction unique.
As we all know, technology is currently changing at such a rapid speed, it's very difficult to keep up the pace with what is considered cutting edge. But Commonwealth Eye Surgery makes having the latest technology a part of their commitment to you.
When I look you in the eye, I want you to know that I really believe in my heart of hearts that we've done everything possible for you to achieve your goals. And I can't look at you unless I'm sure that I've armed myself with the latest and greatest.
Commonwealth Eye Surgery has coined the phrase, "Choose the doctor the doctors choose." That's because Dr. Ferguson has performed more eye surgeries on actual optometrists, ophthalmologists, and physicians than any other practice in the state of Kentucky.
What a testimonial that professionals in the field choose Dr. Ferguson for their vision correction.
These individuals are in the know because they're in eye care in the individual, and they have the means to travel anywhere in the country, and I'm flattered and honored to be able to do their surgery. But I think it also speaks volumes for the commitment we have to getting it right, providing the very best, and doing so the first time.
My father's an optometrist. He referred me to Dr. Ferguson because he said he's the best, and so I figure if my dad trusts my eyes with Dr. Ferguson, I would trust him with anybody's eyes.
From the day Commonwealth Eye Surgery was born, Dr. Ferguson has made 4 things part of the mission in his practice: integrity, accuracy, safety, and a strong commitment to advanced technology.
The technology has become faster, safer, more accurate, and a lot of attention has been paid not just to visual results 2020, 2015, 2025, but also quality of vision.
When you consider a surgery as important as your eyes, it is important to know the motivation behind the surgeon who will care for you. Here's Dr. Ferguson.
Our big push are 3 things. One is integrity. If you're not a candidate, we're not going to push the procedure, and we're going to choose what's best for you. And our job is to teach you and inform you and let you make the decision and then honor that decision. The second thing is safety. It doesn't matter if what your results are if a person is being risked, because ultimately you're going to hurt somebody. So safety is the next. And then the third is accuracy. And accuracy is a work in progress. We take all the results from all our patients and we put them in a data bank, and not just one result. I mean it, 1 day, 1 week, 3 weeks, 6 weeks, 6 months, a year. And we look at how those results change over time, and we are continually refining our algorithms. And that's why our rate of enhancement or redo rate is so low.
Most surgeons speak of a redo rate on LASIK procedures at about 12 to 15% per year. But in Commonwealth Eye Surgery, redo rates are less than 4% from the day Dr. Ferguson did his first LASIK procedure.
That's accuracy. That's a commitment to getting it right the first time.
Another thing to consider when you choose a surgeon is their passion, not only for their skill, but for your results.
The bottom line is seeing them beam when I take the microscope away and I say, "Welcome back to the land of the seeing." And they look up and they break out in this big smile, and that's very rewarding.
It's amazing what Commonwealth Eye Surgery has done for vision correction in Central Kentucky.
Dr. Ferguson is a true leader in his field. He currently serves as the president of the American College of Eye Surgeons. It's his goal to keep surgical standards high among all ophthalmologists.
Another question that is very common is, how much does the procedure cost?
As it stands today, many insurance companies view LASIK as a cosmetic procedure. Whether or not your insurance company will cover your surgery, Commonwealth Eye Surgery has various financing plans available and will work with you to set up a plan that is right for you and your family.
Thank you for taking this time to learn more about Commonwealth Eye Surgery, Dr. Lance Ferguson, and the LASIK procedure. If you're considering LASIK surgery, call today to set up your free consultation. Your eyes are important. They're your windows, and Commonwealth Eye Surgery wants you to see through them clearly. Thanks for watching.
If you have more questions or would like additional information, visit Commonwealth Eye Surgery on the web at commonwealtheyes.com. It's time for you to see what you're missing.
Be the best that you can be. Commonwealth Eye Surgery.